Now, there were reports that the third wave of the coronavirus pandemic would have reached its peak in most of South Africa, but the hospitalization aftershock is catching many communities by surprise. Let's focus on this issue, and for this conversation, we are joined now by Dr. Sheri Fanaroff, a medical practitioner. Dr. Fanaroff, thank you very much for your time. It had been reported, first and foremost, that the COVID-19 numbers were declining, and indeed, they were. They seemed to be quite stable for a while. On Monday, there were 5,683 cases. On Tuesday, 7,700 plus cases. But come Wednesday, we're seeing 17,351 cases. What does this mean as far as the end of the third wave or the peak of the third wave is concerned, and those sentiments and statements that were being made in that regard?
So we do think that we are on the way out of the third wave. However, you do sometimes see these spikes in cases. What people don't perhaps realize is that for every case that is reported and counted, we think that there are probably dozens more cases that have not been tested, that haven't actually been counted and reported in the system. So sometimes, for example, you will get one member of a family who tests positive. That person is counted. There may be another 4 or 5 or 6 people at home. So whatever our numbers are every day, the doctors feel that it's probably an underestimate of the case numbers that they actually are. So, you will see these kind of peaks and troughs, and sometimes the numbers are a bit better than others. It's not always completely accurate. So that's my take on the spike in numbers yesterday. We are definitely not out of the woods. Even though we were out of the wave, perhaps out of the third wave, our numbers are still fairly high. There were still 5,000 cases reported in Gauteng yesterday. A lot of cases in the Western Cape, which is perhaps still on the way up in the trajectory. So people really need to still remain very cautious. We are definitely not out of the third wave yet. We may see spikes again like we did yesterday.
So was it a bit of a premature announcement to say that we may have seen the worst of the third wave and that we have actually peaked?
I don't think so. If you follow the graphs and you look at the graphs, the numbers definitely are trending downwards. So I don't think that it's a premature announcement. Things can change every day. The virus catches us by surprise. Almost every day there are changes. We weren't expecting...
Dr. Fanaroff, I do apologize. May I ask if you could just maybe hang 10 for us, and we'll continue our conversation in just a moment. And we continue now with our conversation with Dr. Sheri Fanaroff, a medical practitioner. Dr. Fanaroff, we thank you so much for your patience this afternoon. Perhaps let's pick up where we left off. You were saying that, yes, we should be expecting the highs and lows, and that perhaps it wasn't premature for government to announce that the third wave had peaked.
So, as I say, if you look at the trends and you look at the graphs, it definitely does look like we're over the peak of the wave, but it's completely dependent on people's behavior, how things unfold in the next few weeks. If you're going to have crowds of people with no masks, not following COVID protocols, then I would completely expect those numbers to go up again. So they did come down with lockdown. If people, we're now in a much lower level of lockdown, but people are still advised to be cautious, to wear masks, to socially distance, and specifically to avoid large gatherings of lots of people. Because if those happen, you're going to see spikes like you did yesterday.
Dr. Fanaroff, could what we are seeing now be part of the repercussions of the mass gatherings we saw during the rioting and the looting over the past, let's say, just over 2 weeks ago?
I think it is possible. The timing fits with perhaps seeing a spike following that. So that was at a time when we were theoretically in lockdown, so schools were still closed, a lot of people still working from home, and that's only opened up this week. But during that lockdown period, 10 to 14 days ago is when there were riots and looting. And in those kind of events with lots of people together and not observing COVID protocols, you would see the repercussions of that 10 to 14 days later, absolutely.
Let's talk about the trend pre the 17,000 new COVID-19 cases. The numbers seem to have been going down at that particular point, but the number of hospitalizations and ICU admissions was actually increasing. Talk to us about that phenomenon.
Well, remember that there's a time lag between people getting infected with COVID, which is usually when a new case is reported, and getting really sick. And we generally are seeing our patients deteriorate from about day 10 of getting symptoms. So somewhere between day 10 and day 20, those patients who are going to get sick would then need hospitalization. And then they may spend a week or so in hospital on oxygen. Perhaps only a week into that would they need ICU or ventilation. And that's why you see a delay between people getting infected and people needing hospitalizations. So we expect the hospitalizations to carry on for longer. What we're also seeing with Delta is that people are staying sicker for longer and the hospital stays are longer. So whereas in wave 1 and 2, people would be in hospital for an average of maybe 7 or 8 days, they're now in hospital for an average of maybe 13 or 14 days. And that obviously fills hospital beds for a longer time.
Now, Dr. Fanaroff, what is the situation as far as the number of daily deaths that are being recorded?
Again, it's difficult to know how accurate those dates are. You know, we are sometimes told that a particular province is reporting a lag in the deaths. They're catching up on dates that weren't reported a couple of weeks earlier. So dates like hospitalizations are going to follow the peak. So our death rate could still go up for quite some time. You might still see 300, 400, 500 deaths even within a day, even though our new numbers are coming down.
And how should we be expecting the statistics for the third wave to fare in comparison with the first two waves?
Well, what we're seeing in this wave is that we don't have enough people vaccinated. So the majority of patients who are very ill in hospital are unvaccinated or not fully vaccinated. So the wave wasn't able to change enough on the basis of vaccinations. We're hoping that once we're through this wave and once the vaccine rollout picks up and more people are vaccinated,
unfortunately,
will
Dr. Fanaroff, I do apologize. I do have to let you go right now. Apologies for that. That's Dr. Sheri Fanaroff.